Scoliosis is otherwise called as hunchback, which is a sideward bend of the spine, commonly seen in children, but it can present even at birth because of some congenital anomaly of the vertebral column. In children, it is a progressive condition, and most importantly, it is a painless condition. The pain could have been a good indicator to diagnose, but having no pain is a deterrent to its early diagnosis. Hence, most children progress, especially during growth spurts like first 2 years of age or 10 to 15 years of age. When the child grows in height, they grow the deformity as well. The child needs to be diagnosed by looking for the shoulder balance, the pelvic balance, and the rib hump, if at all visible when the child bends forwards. The females are being more affected to the extent that 9 times more affected than the boys. The growth of the child is going to be proportionate to the growth of the curve, and if it grows, the child grows less in height and more sidewards. The treatment depends on age of diagnosis as well as the degree of Cobb angle. The diagnosis is done by standing PA radiograph of the whole spine, and this is measured by the angle subtended by the maximally tilted vertebra within the curve. A Cobb angle of up to 10 degrees is normal curvature of the spine. Having said 10 to 25 degree of curve, we opt for observation every 6 months. From 25 to 45 degrees of curve, we give a brace and also ask the child to follow Schroth exercises under supervision. The child needs to wear a brace for 23 hours a day and remove it only at the time of taking bath or playing sports. If a child is unaware and it is ending up with a curve angle of more than 45 degrees at skeletal maturity or any time before that, child deserves a surgery. The surgical options are plenty. In a growing child less than 10 years, you have growth modulation techniques like growth rods or Schilla technique. In children between 10 and 15 or 18 years of age with more than 45 degree of curve, you can do a definitive fusion, either anterior spinal fusion or posterior spinal instrumented correction and fusion. Typically, these surgeries on spinal deformities in children are done using neuromonitoring, which will take care of the neural integrity when we are correcting the spinal bend. Today, we even have robotic assistance to direct the implantation of screws into the spinal column so that the surgery can be done to the utmost safety standards across the world. The child can typically walk after 6 hours after surgery and can be discharged home on the very next day or the day after that. The child will need to come for a dressing after a week after surgery, and the stitches will be removed after 2 weeks after surgery. Child can join back school typically in 3 to 4 weeks, and we defer the child going for contact sports for almost 3 to 6 months till the union is solidly fused. The children with scoliosis have no disability, and it is very important to make sure that it is not a taboo to have scoliosis and they are physically as fit as any other child with or without scoliosis. The scoliosis in the West has got a school screening program and hence detected early. In India, with the absence of these screening programs for scoliosis, we request the parents to note their child's back every now and then, look at the shoulder balance, look at the pelvis balance, see if the child is not standing erect. If you find any doubt, take to a spine specialist, get a standing whole spine radiograph, ask the spine specialist with a special interest in scoliosis to measure the angle. The only way to prevent your child from undergoing surgery is by bracing and by exercises, the Schroth exercises. Take care. Prevention is better than cure, and early diagnosis is the key to prevention.